Thank you, Chairman Cox, and I appreciate the update from Dr. Wooten and everyone's efforts to help us try and slow the spread. We slow the spread of coronavirus in order to protect our economy, keep our jobs open, protect life, protect the integrity of our healthcare system. And we know that we have a ways to go, but we certainly have to continue being very mindful of the metrics we've outlined, and really understanding the significant lag that you often see in terms of ICU utilization, hospital utilization, and death, coming significant increases in those categories sometime after you see a rise in cases. We're seeing a number of places. I think Florida is a good example where a shockingly large number of their counties now have essentially zero ICU capacity in their healthcare system because they had a preceding few weeks ago spike in their cases. And so we're mindful that it is important that we take action before we see the hospital system overwhelmed in an effort to try and avoid that. So I support the efforts of Dr. Wooten and our public health department as we continue to do the best we can to manage through a very difficult situation. I do want to make a couple comments initially, and then I suspect we'll have greater deliberation on this either now or after public comment. Around the CARES Act funding, and in particular the additional $53 million that is coming into San Diego County for us to consider where we would go and what we would do with that. And I want to highlight two things that I think are vitally important to our economic recovery. And that is first the childcare industry in terms of a significant investment that I believe that we need to make in the childcare industry as a component or foundation of our ability to move forward and to get our economy back up and running as we get the slow the spread here hopefully over the next 3 to 4 weeks. And then the second thing that I think we need to focus on is a dedicated and robust effort around testing for our K through 12 public schools. We know simultaneously to childcare that public schools are a vital component of our ability to move forward. And we've been working, my office has been working very hard with a group of scientists, with some of the leading minds in testing from UCSD and Scripps Institute and other places to come up with some foundational ideas for how we might monitor the situation in schools. I think there is some new science around wastewater treatment, around the bundling or batching of tests, along with diagnostic tests. And I know our schools are dependent upon us as a public health agency to be able to come up with a system and a plan and a program that gives us the best shot of monitoring the situation in our schools to protect our children and their parents and their families, along with the teachers and staff who are there. And so what I would do is for discussion purposes, put a motion on the table to direct the CAO to establish a fund totaling $25 million in new CARES Act funding for childcare providers struggling to remain open or reopen due to COVID-19 pandemic. This would be available to cover costs, including but not limited to staffing, supplies, business resilience, mortgage and rental assistance, or capital improvements related to outdoor areas. And second, direct the CAO to establish a fund totaling $10 million in new CARES Act funding to support the county's Department of Public Health testing, tracing, and treatment strategy specifically dedicated to San Diego County K through 12 public schools. And just to add on to what we were talking about around childcare is we know that there have been some efforts. We certainly led in an effort to provide vouchers for this childcare industries, but we have more than 600 childcare providers have completely closed their businesses. And many of them are going to need significant help in terms of accommodating the changes in the number of kids, in terms of accommodating the changes in the safety protocols and procedures. And so I think if our staff could come up with a holistic plan, a regional plan for how we can most strategically invest in helping this industry get up and running and stay up and running in a safe and responsible way, I think that would be appropriate. And then on the school testing, again, we've got over 500,000 school-age children that it is uncertain when or how they will return to school, but we know at some point schools will return. And so it is, I think, vitally important that we get ahead of the curve here on really making an investment to assist our schools and our child care providers. And so I think this wouldn't encapsulate the entire $53 million that we have to decide on, but I think it would be appropriate to invest $35 million of that 53 in child care provider strategy and in testing for our public schools. Thank you, Mr. Chair. I would get a motion going here for discussion purposes, and I'm sure there will be some discussion and some other things, but I think out of the 53 million or so we're discussing on what we would do with, I would make a motion to direct the CAO to establish a fund totaling 25 million out of the new CARES Act funding for childcare providers struggling to remain open or reopen due to COVID-19 pandemic, to cover costs including but not limited to staffing, supplies, business resilience, mortgage and rental assistance, or capital improvements related to outdoor areas. And the second part of that would be to direct the CAO to establish a fund totaling $10 million in new CARES Act funding to support the county's Department of Public Health's testing, tracing, and treatment strategy, specifically dedicated for San Diego County K-12 public schools.
Yeah.
Okay, is there a second to that motion? Okay, dies for lack of a second. Supervisor Jacob, and then Desmond.
Well, maybe I would second if the maker wants to adjust it a little bit. As I do the numbers, we've got 48.8 million because we already spent some. So if the maker of the motion would cut the testing in half, 18.8 million for the Great Plates program, I would second the motion for discussion of that.
I would support that. I think that that's fair, and it shows our commitment to childcare, and it gets us moving with taking care of K through 12, along with addressing the concerns of our seniors. So I'd be happy to support that.
Okay, so we have a motion. If I could speak. And
okay, maybe before you speak, let me just make sure that we are all working on the same numbers. So we had 53.8 million, but 5 million of that I think was already committed to funding the cities, the other 17 cities. So it's 48.8 million. And just so I understand, give me the numbers on the balance of that, where it's going.
So it would be 25 million for childcare to develop a comprehensive countywide strategy around childcare. It would be 5 million for testing to add into what we've already previously allocated for testing, but with that focused on K through 12 public education. And then the remaining 18 million would be focused on the senior program that Supervisor Jacob has outlined. Is that correct, Supervisor Jacob?
yeah, I think it's 18.8 million.
Okay.
To be exact, but yes, those would be the numbers. Mr. Chairman, just want to clarify one thing based on a question that you had asked on the Great Plates. While they're serving about 1,800 now, talking to Kim Gallo, because I had a briefing on this earlier in the week, she had 8,500 calls, 8,500 calls. So it shows that there's a huge need out there. And again, you could call it economic stimulus for the restaurants as well as helping seniors. So I don't know what your thoughts are, but my suggestion would be that to the maker of the motion, that first we try to get agreement on the distribution of the monies, the 48.8 million. And then we can refer that to come back on August 4th so that the CAO has time to put together the actual programs. And at that time, I would suggest we could deal with the actual allocation of the dollars. So I think first we need to get agreement on how we're going to divide up this money and see if there's at least 3 votes to do that. I don't know.
Yeah. Thank you, Chair. I'm fine with that. I think we could look at the either bringing it back in August, or if we provide the direction on the categories, then we can make it a part of the budget process, which will be happening in a similar time frame. So I think we have a few options to consider for implementation of it. But I do think it's important we provide some direction on where we think this funding should go. I also think it's important that we can begin the planning process around childcare. I think we all agree that is a vital component, and it's going to take some time to get folks together to come up with a plan. And I think we have general, not unanimous, but general agreement that we have to do something to help support our schools, as those 2 things are vital components of our economy, and then the other. So I'm fine with that. I think if we do that, provide some direction, don't allocate it, then we can either allocate it, consider the allocation in our August meeting, or just incorporate it into the budget process.
So we would not be taking final action today.
We would be taking a vote to direct this, and then the allocation of it would either come in the budget process or at a subsequent board meeting.
Or on the 4th, maybe. Who knows? We'll see.
So let me.
You could take 5 million out of the testing and put it into the food bank. Maybe that's the compromise. Or to small businesses.
Okay, so let me ask the maker of the motion, which I believe was Supervisor Jacob. Do you want?
That was Fletcher.
Okay, Supervisor Fletcher, I'm sorry. Do you want to basically accept the recommendations that staff has here and include that we refer the additional $48.8 million and how that would be allocated to the CAO, but to give some guidelines in regards to where that might be spent? Is that?
Well, what I would do, Mr. Chair, I think we have certainly an agreement on the childcare component, 25 million to childcare, and I would leave in the money to support our schools. Our superintendents of the county office, of other school districts, are begging for help to come up with some testing protocols. And again, we have some really world-class minds that are working on how we could put in place a system around monitoring our schools. And I think it's vitally important that as a public health agency, we commit ourselves to tackling this issue of supporting our schools in the efforts to ensure they're safe when kids come back. So I think with 3 votes, we have some parameters around this. If we wanted to have the third one just be the 18.8 is around food service and provide some time to work on that, that's fine. But I do think it's important that we start the process on childcare and that we make a commitment to testing for our schools with at least the 30 million that was outlined.
Would you be willing to include an evaluation by the CAO in regards to potentially providing some funding for testing at the border?
Of course. Yep.
So, yes?
Yes.
I would agree with that.